We continue the discussion of pathology of nervous system by discussing the degenerative disorders. So what do I mean by the degenerative disorders is the nerves are degenerating. Okay, so what are those diseases? Multiple sclerosis, Parkinson's disease, amyotrophic lateral sclerosis, myasthenia gravis, and Huntington's disease. First, we are discussing the multiple sclerosis. What happens? This is the healthy neuron. You can see, which helps with the vision, the spinal cord, all the senses, and the muscles, and you can hold a cup of coffee properly, and the Schwann cell with a proper structure and conducting the impulses and everything. Multiple sclerosis, the neuron is damaged in the brain. Okay, see over here, no continuous myelination. See, so there is an exposed fiber, damaged myelin, so the impulses are not getting conducted properly, incomplete conduction. See, so the person can have mouth and speech problems, can have digestive system problems, can have urinary system problems, and you can drop the cup of coffee. Okay, so what exactly is multiple sclerosis? It is a disease in which slowly mm, the myelination is getting destroyed. Okay, it's a progressive demyelinating disease. Because the myelin is getting affected, the conduction is getting affected. The cause is generally considered an autoimmune, an abnormal immune response. Okay, so antibodies fighting against the myelin coverings of the nerve cells. Signs and symptoms can be visual problems also, sensation problems also. There can be complications related to mobility, moving. There can be respiratory infections also. There can be any contractures or the muscles forming contractures, anything. Okay, the treatment of multiple sclerosis is unfortunately any definite drug is not available, but a symptomatic treatment can be given. Like if there is a visual problem, you try to manage the vision by some way. If there is any GI problem, you try to manage by giving antidiarrheal or anti-constipation drugs or something like that. Okay, so that's about multiple sclerosis. Next we are discussing is Parkinson's disease. It is a degenerating disorder. Okay, so what happens over here is the motor functions are affected, and the brain, the substantia nigra in the brain, which is supposed to release the dopamine, which is actually a inhibitory enzyme, and which is the one which tells us to stop moving when we are supposed to stop moving. But because there is a degeneration happening in the brain, the dopamine does not get released, so the stop signals is not coming to us. So if we are moving, we keep on moving. If we are doing some action, we keep on doing that action. Okay, so the motor symptoms are affected here more. That's Parkinson disease. What are the, you can see there can be mass face, stooped posture, there is rigidity in the back, there is a forward tilt of the trunk, a reduced arm swing, flexed elbows and wrist. There can be hand tremors, the motor function. Remember, no inhibition by the dopamine. There can be tremors in the leg, the slightly flexed hip and the knees, and the shuffling short stepped gait. Okay, so Parkinson disease individuals have a typical gait, walking style. They start with short, shuffled steps, and slowly the speed increases. Okay, so much that they try to walk very, very fast, and if not stopped, they can fall down. Okay, another feature of a Parkinson disease is if they have like pin rolling. So if they are moving their fingers, like they are moving a pin in between their fingers, they will keep on doing it. Okay, so those are like features of the Parkinson disease. um, why? Because the dopamine is not getting released. Okay, and what did dopamine do? Dopamine stopped all these actions, stopped all these motor actions. Okay, the development of Parkinson disease is maybe gene related. It can be due to any drug that the person is taking. um, Signs and symptoms we have already discussed over here. The treatment is because dopamine was less, remember, so give a dopamine. That's a dopamine replacement therapy. Okay. The next disorder that we are discussing is the amyotrophic lateral sclerosis. The amyotrophic means muscle wasting, sclerosis means degenerating or hardening of the lateral corticospinal tract. Remember when we discussed the spinal tract in the physiologic portion of the nervous system, and the only tract I discuss is the lateral corticospinal tract. Because of this, because these tracts are affected, so the motor functions of the person is affected. Okay, so there is a progressive decline of the motor functions, and there is cognitive functions are retained. And these persons are generally subjected to they are generally the ones which are asking for euthanasia, because this is a non-treatable disease. And one such example of a person having ALS is Stephen Hawking. Okay, remember the Stephen Hawking, the brilliant scientist? He had ALS. Okay, and those brilliant person lead to brilliant debates that should euthanasia be allowed in those people having such because they know, like, slowly they they have developed all the motor skills, and then they slowly start losing everything. Okay, so you see over here, this is a normal axon, normal muscle. Look at the affected nerve, look how thin it is and how broken down and irregular it is. Look at the muscle, it is also drying, it is getting atrophied. Okay, so that's the ALS, a motor neuron unit. A person can have difficulty in walking, they can also trip and fall, there can be a lot of leg weakness, the patient individual can have a slurred speech, there can be excessive choking also because of the muscle contracting all of a sudden. There can be weakness in the hands, muscle cramps, then they generally go into a wheelchairs, and after they cannot move at all, the patients have to be lifted by hydraulically. Okay, so because the progression is so bad, and because everybody knows that there is no treatment, so instead of like going to the extreme stage, they request for euthanasia. Next we are discussing is myasthenia gravis. Myasthenia gravis is an autoimmune disorder. It impairs the receptors for acetylcholine at neuromuscular junctions. The signs and symptoms are, you can see over here, drooping of eyelids, the lips is also drooping, the weakness progresses daily, activities become difficult. This is a treatable condition. You can give anticholinesterase because they are the antibodies which are acting against the specific receptors. You can help those receptors by giving those drugs, okay, like anticholinesterase, pyridostigmine, neostigmine. You can also do plasmapheresis to remove all those unwanted antibodies so that the person can have normal functioning. Okay, and this is what happens, this is the neuromuscular junction. Okay, the nerves are releasing acetylcholine, which is supposed to normally act and go through, but because they are blocked by some abnormal antibody attaching to it, so it is not, the acetylcholine cannot pass through. So what they give is anticholinesterase. So cholinesterase is breaking down the acetylcholine, so you do not want the acetylcholine to break down, so you give anticholinesterase so that the acetylcholine can increase in more amount and fight against this antibody and can start working. Okay, next we are discussing is the Huntington's disease. It is a disease which is generally which is inherited, but the problem with this disease is it manifests quite late. Okay, so it manifests when the person has already had kids, and then it manifests, and the symptoms are very bad. So this disease was much discussed because if the individual would have known that they have Huntington's disease and they carry the Huntington gene, they would not want a baby to come, because the baby is definitely going to have the Huntington gene because it's autosomal dominant disorder. Okay, so the other problem is there will be a decline. What will be the signs and symptoms? There will be a decline in the cognitive function, there will be physical impairments, there will be behavior problems. It's a genetic disease and there is no cure for it still. Okay, and equally, even if you have a male or a female baby, both of them can be equally affected. Okay, and it progresses very slowly over a period of 70 to 20 years until the person finally achieves death. And it generally starts when the individual is around 35 to 60 years old. Any age it will start. Okay, so by the time by this person has lived everything and enjoying the youth, and all of a sudden the signs and symptoms start happening and everything starts declining, and there is a 50% chance of the gene going into the child. Okay, 50%, which is a very big percentage. Okay, so that's why it is better if to know early, so that if they are planning on bringing a baby, they get the gene tested in the baby also. Okay, there is a progressive atrophy of the brain, there is a degeneration of the neurons in the basal ganglia and the frontal cortex, there is behavior changes and stuff like that. The ventricles can be dilated. The signs and symptoms are mood disorders, jerky movements, and the intellectual impairment. They cannot think and do stuff like they used to. The test is by doing the DNA test, looking for the gene. Okay, unfortunately no specific treatment is there. That was about the degenerating disease. Now we are going to talk about the dementia, all those forgetfulness. So first one is the Alzheimer's disease, then we are going to talk about vascular dementia, Creutzfeldt-Jacobs disease, and AIDS dementia. Okay, Alzheimer's, it was already discussed in the class in a very nice way. It is a form of dementia with progressive loss of cognitive function and personality changes. It is generally seen in individuals which are greater than 65 years of age. Females are more affected than the males. Signs and symptoms are personality changes, lack of initiative, repetitive behavior, there is impairment in the judgment, and there is abstract thinking, the problem solving abilities, everything is affected in Alzheimer's disease. Okay, what is the pathophysiology? There is a progressive cortical atrophy, there are dilated ventricles and widening of the sulci, neurofibrillary tangles are seen in the neurons, and senile plaques are found in the larger areas in the brain. Plaques disrupt the neural conduction. And what are the plaques made up of? They are made up of the beta amyloid precursor protein. So it is basically a protein, which is amyloid protein, which is found in our body. It's a very abnormal protein because it does not get disintegrated, it generally gets deposited at abnormal places. Okay, it can deposit in the kidney, it can deposit in any place. So when it gets deposited in the brain, it leads to Alzheimer's. Okay, there can be also deficiency of acetylcholine, and so it leads to all this stellate of signs and symptoms. Okay, diagnosis of Alzheimer's is based on the observation, and a progressive test of memory can be done. So how do they test memory? They show 5 objects and then take a time of 2 to 3 minutes and then ask them to repeat the 5 objects that were shown to them. Okay, etiology is generally genes associated with Alzheimer's disease on chromosomes 1, 14, and 21, and they are autosomal dominant. There can be a late onset Alzheimer's disease which is linked to the mutation on chromosome 90. Okay, signs and symptoms: early stage will have a gradual loss of memory and lack of concentration. Ability to learn new info and to reason is affected. Behavioral changes, like a person is very irritable and very hostile, mood swings can be seen, cognitive functions, memory, language skills, everything keeps on deteriorating. Apathy, indifference, and confusion can become more marked. Daily activities like preparing meal or dressing or personal hygiene, even they become difficult. The late stage person is not able to even recognize his or her family. There is no awareness or interest in the environment, and incontinent, like they cannot hold urine and stool. What is the treatment? There is no specific treatment to reverse the effects of Alzheimer's disease. So what is given is generally occupational therapy is given, which is important in the assessment and provision of devices to provide safe environment. What do I mean by that? You assess what stage the person is in his Alzheimer's disease. If they are in the late stage, they are going to be incontinent, so you might need to provide stuff like diapers, you might need to provide stuff like pooping bags and stuff like devices like that, or or reminders around them, so they remember they have to do these activities. They might need reminders to go to brush their teeth, to take a shower. Everything might have to be done. Okay. Drugs that cause mental confusion are contraindicated. Of course, already the person is going into so much of confusion, why would you want to increase it? So all those drugs which can cause mental confusion are totally contraindicated. Anticholinergics are said to provide a temporary benefit because still some acetylcholine transmission can improve some of the condition. Okay, so anticholinergics were provided so that acetylcholine can help regain some of the functions. Okay. Daily routine and secure surroundings facilitate compliance with care. Okay, so the best thing you can do for an Alzheimer's individual is set up a routine, like get up in at the specific time in the morning, perform this activity, then this activity, then this activity, and like this everything should be properly organized, so that ways they can have a safe living. Okay. The next dementia types were vascular dementia, which is caused by the cerebrovascular disease, like small brain injuries or infarctions. Sorry, Creutzfeldt-Jakob disease is a very rare, rapidly progressive form of dementia. It is caused by the infection by a prion. Okay, infections are caused by bacteria, infections are caused by viruses, by protozoa, by helminths, so many different types of organisms. One such abnormal thing is prion. We did it when we were doing general pathology, and at that time also I mentioned this disease. So that's a Creutzfeldt-Jakob disease. Okay, a prion, a protein particle. AIDS dementia is seen in the later stages of AIDS. That was covering basis of the nervous system. Now covering to give an overall look, we are going to look into some of the mental disorders like schizophrenia, depression and panic disorder. Okay, mental disorders are classified on the base of DSM. That's a diagnostic and statistical manual of mental disorders, which is published by the American Psychiatric Association. Okay, and they are the ones who label, okay, what disorder comes under which category. First, we are going to discuss schizophrenia. Schizophrenia happens because there is a decreased blood supply to the frontal lobe. Remember, change in the behavior. It can be due to perinatal infection or any genetic disease. The signs and symptoms can be disorganized thought processes, neologisms. You know what is neologism? Forming new words. The drugs are generally antipsychotics, psychotherapy, and psychosocial rehabilitation. Okay, you try to prevent the damage to the individual. Okay, what is how do you identify a person is schizophrenic? Both the symptoms may be present, positive or negative. Positive is the person will have delusion. Oh, I am the king of the world. I can do this. I can do that. They will have hallucinations. They will look at a rope and they might think it's a snake. Disorganized speech, saying anything. Okay. Negative symptoms like a flattened affect. You say anything, no expression will come on the face. Reduced speech, they will not speak much. Lack of initiative, so kind of like depression, not saying much, not doing much, no expression, nothing. So the schizophrenia can have both of these. Okay. Treatment is antipsychotic. Okay, risperidone. Next disorder we are discussing is depression, which is a very commonly seen disorder in our society. It's a unipolar disorder. Causes can be genetic, developmental, psychosocial stressors. There can be a history of some major psychosocial trauma. Treatments are generally antidepressants, which increase the norepinephrine activity. There can be signs and symptoms like the person feels helplessness, guilt, anger, withdrawing from the friends and family, no concentration, thoughts of death, change in appetite, energy loss, sleep problem, and excessive use of alcohol and drugs. All these are the indications of depression. Okay, treatment is take the antidepressant because it will increase the norepinephrine activity, and till the time you can, you know, be strong again, it the drugs can be helpful. Next we are discussing is the panic disorder. Panic attack, it is a sudden brief episode of discomfort and anxiety. There is increased discharge of neurons which may occur in the temporal lobe. Biochemical abnormalities of norepinephrine, serotonin, and GABA. GABA is gamma aminobutyric acid, which is a neurotransmitter. So there is some, these three are the neurotransmitters of the brain. Okay, all the transmission in the brain goes on through these norepinephrine, serotonin, GABA. If any imbalance or any problem happens in this, it can lead to biochemical abnormality, can lead to a panic disorder. Signs and symptoms is episode of intense fear without any provocation, which can last for minutes or hours. There can be sudden palpitations, there can be sudden tachycardia, fast beating of heart, there can be sudden hyperventilating, sweating, and a feeling of terror. Okay, I think everybody has at least seen or managed or felt a panic attack some point in their life, so you can understand, right? Treatment is generally psychotherapy. You have somebody who's there to calm you down, to, you know, prepare you. That's psychotherapy. And there are some, if still it persists, there are some drugs which can help with that disorder. They are called the anti-anxiety agents. Okay, that was about the mental disorders. The last which we have to discuss is the spinal cord disorder, which is the herniated intervertebral disc. So you know the spinal cord is in the vertebral column, right? The vertebral column is like this. Okay, now due to some injury or due to aging, the vertebral column gets may change its place. Okay, like it might shift because of the any minor change in the place of the vertebral column. The spinal cord that is passing through and releasing a spinal nerve can get compressed, and that can lead to some different signs and symptoms. Very clearly you can see over here, this is the spinal cord, this is the nucleus pulposus, this is a spinal nerve that is coming out. That spinal nerve gets compressed because of the herniated disc that is coming out from the spinal cord. Okay, so what is herniation? It is the protrusion of the nucleus pulposus through between the disc, and that protrusion can compress the nerve. How does it happen? By improper lifting of stuffs. That's why you get definite trainings. When you are trying to lift heavy objects, you are supposed to lift it with your legs, not with your back. Okay, that's the term that they use, lift with your legs. If you lift with your back, you are going to injure your back. The signs and symptoms are paresthesis, numbness, tingling, which can occur depending on the site of the compression. The test can be myelography with contrast dyes, CT scan, MRI. Treatment is generally bed rest. Sitting position exerts maximum pressure on the spine, so proper back education can help. Okay, just as I said, you have to have a proper education for your back. Okay, that was about the disorders. I've been told that I have to include some content which helps with the nursing management. So here's what the care that you can provide to an individual who is suffering nervous system disorder. We can maintain the fluid volume balance. So how much fluid is going inside, how much is coming out can be maintained. The skin integrity has to be maintained. You always look at the skin, that it shouldn't be dehydrated, dry or anything. Mouth and cornea care has to be taken because they are paralyzed, right? So the drying of the eyes should not happen. So that, and the mouth, if there is a lot of saliva in the mouth getting accumulated, that might need to be removed, otherwise they are going to have aspiration. There has to be an effective thermoregulation because the the individual has paralysis and affected nervous system. The heat and the temperature of the body is not properly regulated, so you have to take care of the thermoregulation. Promote the bowel bladder function. If they are paralyzed, tell them to maintain the proper bowel and bladder. If they have not done, give them the suppositories and maintain the bowel and bladder functions. accurate perception of environmental stimuli. By how can we help do this is by showing them different objects, trying to talk to them about it, trying to tell them about stuff so that they still have a proper perception of what is the things around themselves. Maintain an intact family or support system by proper communication. You do not want to pressurize them to have the relationship, but they should at least have a support system, right? And making sure that no complications develop in them, like if they are completely paralyzed, we might need to change their positions from time to time, otherwise they are going to develop all those bad sores and all those complications, infections. So we need to change their bed sheets frequently, we need to change the positions frequently. They, if they are not breathing properly or if they are on ventilation, they need the chest physiotherapy regularly. So by making sure that they do not develop any complications is how you can also provide care. Okay, that's all for the nervous system. If you have any questions, you can ask them.